I'm Dr. Messina. Today, I'm going to be discussing topics in the media regarding the SARS-CoV-2 viral illness and COVID-19. As you can see, we still have the hairy variant with us. The hairy variant doesn't go to the lung, it goes straight to the heart. But unfortunately, the hairy variant doesn't like to be alone. So he's going to be in our video today. When we see this first clip,
I recently had COVID again, so the virus has once again become intensely personal, and now I'm pissed. Like many of you, I took all the recommended steps and took the necessary precautions, but like a fool, I figured if I had been previously infected and vaccinated, well, I'd be safe.
When she states that despite being fully vaccinated, she got sick again, I could fully understand the anger in that. See, when I got my M-RNA vaccination, I couldn't wait to get the second dose. And I had thought, I'm going to get that second dose a month later, I'm going to throw my mask into the wind, and I'm going to run around like I used to do. But unfortunately, while those mRNA vaccines offered about 95% protection to the virus that was circulating at the time, however, variants came along. Variants with changes in the genetic structure of the virus that were enough to elude our vaccines. And a lot of data and a lot of articles have come out on this. Here we have one from the United Kingdom, stated that Omicron largely evades immunity from past infection and from our vaccines. It's really no surprise that the Omicron variant evades natural immunity and evades our vaccines. The reason why is when we have the infection, our bodies produce antibodies to the virus, to the spike protein. And when we take a vaccine, these vaccines are not targeting the virus as other vaccines did, such as polio and smallpox. These vaccines that we have today are targeting the spike protein. So, in the case of Omicron, where the spike protein has 30 mutations, the largest number of mutations to date on this virus, it runs the potential that it's going to evade natural immunity and vaccine immunity, and it does. In order to really understand this, we have to look at how these vaccines are working. Some vaccines have virus in there, either live but attenuated, meaning they can't get you sick, or dead. And it instructs our immune system to seek out that virus and attack it. However, the mRNA vaccines from Pfizer and Moderna do not instruct your immune system to attack the SARS-CoV-2 virus itself, and instead attack a spike protein that's found on the surface of the virus. Well, when that spike protein mutates, as it did in Omicron, 30 mutations in all, which is a record for mutations for this virus, our immune system no longer recognizes it. Therefore, you could still get an infection. It's probably going to be a lesser of an infection, but you can still break through. If you've had one dose of Johnson & Johnson or the Pfizer or the Moderna vaccine, you basically have no protection. If you've had the second dose of Pfizer and Moderna, you have about 25% immunity with each of them. If you get the booster dose of the Pfizer and the Moderna, you go up to about 80% protection, which is excellent because people like to think that they're 100% protected, but we very rarely are. Even our flu vaccine is only 40 to 60%.
With a normal virus that naturally evolved, that might be the case.
The person says some things in the beginning that are very upsetting. First of all, she gives the impression that she has documented proof of the origins of the SARS-CoV-2 virus. Documented proof that it came from a laboratory and was either deliberately released or accidentally leaked to the world. When in reality, there has been a tremendous amount of investigation done, and it still seems that the most likely origin came from a mutation from a coronavirus that was supposed to be in the bat population, yet the mutation allowed it to cross over into the human population. And usually when that happens, it's a very potent virus, and it usually hits the new host particularly hard. There hasn't been any hard data to prove that this was initiated in a laboratory or released from a laboratory. We still don't know. But the important thing is to not dwell on the origins of the virus, at least at this time, but to find a way to protect yourself and to find the way to treat it should you get sick.
If you've had COVID, you know it is extremely unnatural and doesn't feel like anything you've experienced. Even if you had it mild, you know it's still weird.
In the second part of the video, they were saying that you could tell by how sick you got that this was like no naturally occurring virus, again insinuating it was lab created. But what really happens is, whenever we have a novel virus, which is what this was, it tends to hit us very hard. The reason why is our immune system is not really accustomed to it at all. And sometimes the immune system doesn't really know how to respond to something like that. We saw that in the War of the Worlds movie, where the aliens were just fine until they got out of the spaceship and were exposed to our viruses, which were not found on their planet, and they started to succumb to it very quickly. Whereas that's a fairly radical thing to occur, we are seeing something like that with this SARS-CoV-2 virus, and that it's a novel virus, and it tends to hit us particularly hard. COVID-positive nurses being asked to return to work. This is a really unfortunate turn of events. And what's happening is, despite people thinking that medical staff don't get sick, we have a very, very contagious disease with the Omicron. It spreads more like the measles. So a lot of people get sick, a lot of people get sick fast, and hospital personnel is getting sick. And we're having a tremendous nursing shortage throughout the country. So some of the rules have changed. So now, if the nurses are asymptomatic but positive, they could work. If they were ill and they're feeling better, and it's 5 days, they could come back again. Which really wasn't what the regulations were a year ago, but we're having a very hard time staffing hospitals. That's what makes this Omicron so ominous, in that we can overwhelm our system, maybe not with critically ill patients, but patients coming to the emergency room for care and staff getting sick and not being able to work. Rapid COVID tests being feared to be giving false negative results. That's true, and that's been a problem during this entire pandemic. You see, there are 2 tests to determine whether you have COVID-19. One test is the rapid test, and it's checking for a viral protein. And it gives you a result in about 15 minutes. And it's an excellent way to do a quick spot test to see if somebody is sick. If you have a rapid test and it comes back positive, then you have the COVID-19 viral illness. If it comes back negative, you have to kind of look at the clinical picture. If somebody is perfectly well and they just go and get the test for the heck of it just to see, and it's negative, they're probably negative. But if somebody has all the symptoms of COVID-19, gets the rapid test and it comes back negative, well, it's probably a false negative. And unfortunately, the way this test works is the great benefit is a rapid result. The great negative is that about 50% of the negatives are false. Which means that if somebody comes in with all the symptoms and has a negative rapid test, you want to do a PCR test. The PCR test checks for genetic material from the virus. The good part about the PCR test is It's extremely accurate. The bad part is it used to take about 24 to 36 hours to get a result back. However, when we have 1 million new cases a day in this country, the testing sites and the laboratories become overwhelmed, and it's not uncommon for people to wait 5 days for a result.
My daughter tested negative at a clinic on a rapid test. The PCR was positive, but it took 10 days to come back.
One of the problems with the PCR test is if you were ill and got better and then did another PCR test, it might still come back positive, even though you feel perfect. The reason why is the PCR test, again, while looking for genetic material of the virus, that genetic material might still be there except on dead virus. So usually if you want to see if you're positive or negative, you're better off doing a rapid test after you've recovered. The accuracy of rapid tests in early disease has also been in question. Here we have the problem of somebody not feeling well, getting a rapid test and it being negative, and then finding that you probably need a higher viral load for this test to be more accurate, especially if you're only doing a nasal swab. They're finding that somebody might be feeling ill, do a rapid test, be negative, come back 2 days later and be positive. So now the recommendation is if you're going to be early in your illness and you want to do a rapid test, to not only do a nasal swab, but to do a pharyngeal swab kind of where your tonsils are. And it's recommended you have somebody do the pharyngeal swab just because it's a difficult thing to know the exact placement without seeing it. Most people are still wearing cloth masks, and here's the problem with that. Well, cloth masks are very popular amongst the lay public. The reason why is they're very comfortable. They fit nice and snugly over the nose and mouth. There's not a lot of pressure on your face as you get with an N95 mask. However, they're really not effective. The pore size is too great. So even during the classic COVID-19 that we had last year, cloth face masks were not that effective in protecting you, and should you have coughed or sneezed, you would spew out particles through them, probably making conditions worse, because some of the particles might be broken down into even a finer mist and spread easily to the next person. The Omicron variant spreads very easily, like the measles. Therefore, you're not getting a lot of protection with a cloth mask, nor are you protecting the people around you. The masks offering the best protection are the N95 masks, but they're very snug to the face, and they're somewhat uncomfortable to wear for a prolonged period of time. If you don't want to wear an N95 mask, then the next best thing is the 3-ply masks that we wear in the operating room. They're usually blue on the outside, white on the inside, and they have 3 layers of protection in there. Here we have 125 or 179 passengers previously negative turning positive after a flight from Italy to India. I looked into this to see how long does it take to get from Italy to India, and it took about 8 hours. So these passengers definitely did not get infected during the course of the flight. It's just not enough time. My feeling is with this is that these people probably were infected, and whoever tested them either was doing it incorrectly or they had some faulty kits, because to have 125 false negatives out of 179 total is an awful lot of false negatives, well beyond the statistics of what you would expect this false negative to be. So I think in this case, it was testing abnormalities. This one I loved. COVID-19 bringing back one of the oldest and strangest fake cures. See, colloidal silver was used probably in the 40s. At that time, they were using it mostly for sinus infections, putting colloidal silver on a swab and sticking it in the nose and leaving the swab there for a few minutes. And indeed, it helped things because colloidal silver kills things. Unfortunately, there's a bad side effect to colloidal silver. It led to a condition called argyria, which was a blueing of the skin, of the entire body. And it's permanent usually. There's a potential that maybe with aggressive chelation therapy you could get some of that colloidal silver out. However, the risk of getting argyria was very high. In fact, a teaspoon a day is enough to cause it. The colloidal silver has no benefit in treating COVID-19. So it's another one of these charlatan therapies. So again, it's not something I would recommend. Well, that's it for today. I hope you found some of these articles interesting. And remember, if you like this type of thing, click subscribe, hit the bell, and be alerted to future videos. Take care and be well. I think the hairy variant fell asleep during the video. I hope it doesn't mean I'm too boring.